We had very many Kenyans. We used to do a lot of fundraisers on WhatsApp. You remember? Where are those fundraisers right now? We barely have them. Once you contribute right now, there's no discrimination on service provision. You just go to any health facility.
ETV Africa News at this hour.
I am Mohammed Saeed. I'm a healthcare consultant. I came here at the invitation of the speaker to come and clarify a few issues regarding the Social Health Authority, as per my understanding. Thank you so much. So, for me, when we talk about the Social Health Authority, that is one pillar of health, which is the healthcare financing. In Kenya, we have had very many years of neglect of healthcare financing by the previous administrations. This is the reason. We had an institution called the National Health Insurance Fund, NHIF. We all remember, right?
Yes.
The NHIF never used to work for the general population. Do we all agree with that? Because the National Health Insurance Fund was being financed through member contributions. But if you look at the financing part of it, it never covered everybody, the general population. It was not covering the general population. It had 96 different managed schemes inside the NHIF, which we call now the special schemes. Those special schemes, one was for the teachers, another one was for the pensioners, another one was for the National Council of People with Disability, the people who have disability. The other one was for the wazee. So we had these special categories of people within the fund. And if you look at also the contributions they were making vis-a-vis the expenditure, for every single cohort of this special categories of people, the expenditure was higher than the contribution. That is why NHIF, as it stood, was not able to work it out, and it was almost collapsing. That's the reality. That's what we have not told the people. So we had a situation where we had these special groups of people, majority who are publicly employed, who are benefiting from the insurer, yet everybody was being told to contribute. We knew. We had very many Kenyans. We used to do a lot of fundraisers on WhatsApp. You remember? Where are those fundraisers right now? We barely have them. Once you contribute right now, there's no discrimination on service provision. You just go to any health facility, you are clerked there, you register. As long as you've registered, you enjoy the services. If it is a primary health care, you enjoy services at outpatient level. If it is an emergency, once you are already registered, immediately you are evacuated to a health facility. You'll get the service, regardless of the size of the facility. Now, the Social Health Authority, we have what we call the UHC, the Universal Health Coverage. The Universal Health Coverage had 3 pillars. One pillar was what we call the access to healthcare. The other one was quality. Is the service you are getting at the health facility level, whether it's a public or private, is it quality? Are you getting quality services? The third one was equity, health equity, which now here comes what we call the social protection. We had a lot of millions of Kenyans that are sinking into poverty because of having a relative or a cousin in a hospital, and they were forced now to sell off their properties to pay that hospital bill. We have seen very bad things, right? Now, this UHC thing started way back in 2003. We had what we call the Gill Bill that was brought to Parliament at the time. The Gill Bill was passed, but it was not accepted by the president because there were cartels and there were people who did not want it to pass. That Gill Bill was to give a legal framework for the implementation of universal health coverage, to have a healthcare ecosystem that actually works for the general population. But it was shut down by the president at the time. Why? Because we have private insurance that were jittery at the time. They were fearing that it was going to cripple them. Because most of these private insurers are receiving funding from our parastatals and our public and private sector corporations, that are actually funding them. So once the UHC was implemented, it was taking a good chunk of all these contributions that have been made to provide health insurance will be directed to this insurer, which was very difficult for them. So they lobbied and it was shut down. That's how it died. So we continued with NHIF until the year 2024 when we started implementing 2023, when we passed all those four laws. Under the UHC, we had the Social Health Authority, which is the umbrella body. Then we have three different schemes, which we have the Emergency, Chronic, and Critical Illness funds. Then we have the Social Health Insurance Fund. Then we have the Primary Healthcare Fund. These are three different funds. For the Primary Healthcare Fund, you're supposed to enjoy this from level 1 to level 4. This is now that's supposed to cater for your outpatient services when you go to a public facility, and you don't have to pay for it. You just register. For the Emergency, Critical, and Chronic Illness Fund, you are also supposed to register. Once you register, then the government has already allocated fund for that. I think 5.8 billion was allocated to service that. The issue now, the biggest problem now we have, the reason why you see a lot of noise around here is they're not complaining about these two other funds. They're complaining about Social Health Insurance Fund, the SHIF. The SHIF is just one component of it, of this healthcare financial architecture. The SHIF now is the contributory fund, where now the public are supposed to register, then they contribute. They have premiums that are set there. If you are someone who is already in the public service or in the private sector, you are formally employed, you are supposed to have it deducted from your payslip at the percentage of around 2.75%. Once you are deducted, you're automatically already a contributor. So with that, the reason why we have a lot of noise, that's what I want to address. Healthcare has always been very noisy. It's not because other sectors in our country are not having problems. We have problems in agriculture. We have problems in other sectors like roads. But because healthcare is very loud, because healthcare is an essential services, you can't stay without healthcare, but you can stay without a road, right? Yeah. And immediately you have a relative or you get sick, you feel it very quickly. That's why it is a very loud space. The other thing is because also the healthcare workers, the human resource that we have, they are also very educated people. The people who have masters and undergraduates, they have gone to school for very many years, and they have a lot of, they also have associations and welfare associations. They also have unions. They are unionized. They are able to process issues very quickly. Once they see an issue already that is there, that's having trouble in the health sector, they bring it to the limelight immediately. That's now coming to my last issue, which I want to talk about, is now fraud. We have had a lot of people talking about fraud. You have had the CS for Health talking about fraud. Mansi Bwagangi, the CEO, also talking about fraud, healthcare fraud. Healthcare fraud is a problem in this country because Kenyans, we have a problem with our ethos. We have a very serious problem with our ethos. You see, once a person is appointed into a public office tomorrow morning, he's maybe from your village or he's a relative of yours, and he's maybe appointed to be a CEO or to be a director somewhere. What is the first thing you talk about? You start asking, like, oh, what kind of car does he drive? What kind of house does he have? Does he live in Lavington? Does he live in Kileshwa? Those, posh areas. You start asking, oh, where do his children go to? Are they going to group of schools? You see, that is a problem with our mindset as a country. So healthcare fraud is there, and we have lost resources. Because why? When we are designing these systems to work, the healthcare ecosystem, when we are trying to work it out, we are working it out because we are thinking the people here have ethos, the people are not corrupt, the people are not engaging in fraudulent practices. But it is not the case. You see, we have very many thieves in this country. They are stealing from the public. So what they do is, someone now, you have heard when SHA was being rolled out, there was that option of once a hospital, a health facility is already registered with Kenya Medical Practitioners and Dentists Council, immediately you are supposed to be onboarded to provide services with SHA, which was never the case under NHIF. NHIF, it had some level of bureaucracy. For you to be a hospital facility to provide services under NHIF, it used to take 6 months for you to be onboarded, to be empaneled by the National Health Insurance Fund. It is not the case right now. When SHA started in October, They said now once you are already registered as a health facility with the medical board, immediately you are onboarded automatically, because they already have the information with them, which the board had already shared. So people started taking advantage of that weakness. They started registering fictitious fake facilities. They're saying they started getting registrations for fake hospitals. Then they started onboarding themselves on SHA and trying to admit ghost patients and stealing money from the public. So with that, now, my last shot is here. If you want things to work in this country, it doesn't. You don't have to be persuaded by the political class in this country. Yes, you're already a Kenyan. Once you're already a Kenyan and you have an ID, you have voted for a member of parliament in your constituency, you're automatically in government. You don't have to be in government, or we don't have an opposition in healthcare. We don't have people who are in opposition in the healthcare system, because all of us, we feel it if there's a problem. Yes. So, you see, don't categorize yourselves into different, regardless of your political persuasion. Let's support what is right. Thank you so much.
Correct.